Hey, it's Naturopathic Medicine Week, and I'm Dr. Brianna Botsford, the founder of Flow Functional Healthcare in Edmonton and a naturopathic doctor myself. This week is a time to celebrate naturopathic doctors, whole person care, and taking charge of your health from the inside out. This week, we're sitting down with our patients and colleagues who want to share their unique experience working with naturopathic doctors. Whether you're curious about natural medicine or ready to feel inspired to take action for your health, you're in the right place.
Hi, I'm Dr. Miranda Hoskins, a naturopathic doctor at Flow Functional Healthcare, here with Dr. Brianna Lutz, my colleague here as well. Today, we are chatting about our mentorship relationship for Naturopathic Medicine Week. So, for the first question, how did our mentorship relationship start?
So I would want to go back to the beginning, but I think it's funnier to tell it in like a How I Met Your Mother version, and jump around a little bit. In the midst of COVID, I had gone back to the college and it was just a trade show because I was consulting for a different company. And I had this masked woman run up to me and was like, "Oh my God, are you Dr. Brianna?" I was like, "Yeah." She's like, "Dr. Brianna Lutz." I'm like, "Yeah." And she's like, "You're the reason I'm here." And I was like, "What the heck?" So then she explained that she had interviewed me at a previous clinic, asked me about becoming a naturopathic doctor. And that was kind of like where our first meet happened and kind of like where the relationship built. It's very cute, very cute. And then from there, as part of our naturopathic training, we have to do preceptorship hours. So basically observing in clinic with different practitioners. And so Miranda had asked to observe at Flow Functional Healthcare, where I'm also practicing. And that was as a student, just learning. And I have a very inquisitive mentorship style that I like to put people on the spot and ask them questions. So it's not just strictly observing, you're kind of space and understanding my thought process. And in all types of medicine, you kind of learn one, see one, do one. So I think that was a nice evolution that you learn about this process in school. She was able to observe that clinically and then now has transitioned as a provider at Flow Functional Healthcare. So she is doing that all the time now.
Yeah, so definitely highlighted the preceptorship that we take on as naturopathic students, but how does that transition into a professional mentorship where we're both practicing?
Yeah. So I think there's some formal and informal aspects. I think overall, clinic is unique in that we are asking questions to other providers all the time. So it can be quick questions about practice logistics and tests, certain supplements, medication questions. But then we have a bit more of a formal process where we book time together, do case management. So it can be going through either challenging cases. I tend to go on tangents and rabbit holes. So it might be a case, say, on premature ovarian insufficiency. This is maybe the first time that Miranda's worked it up clinically. And then that creates more of an opportunity for conversation of how do we approach this case naturopathically. So what are the lab testings we do? What types of questions are you asking? Prescriptions or nutraceuticals, or maybe how does that translate to a conventional approach as well? And how do we marry those two?
Yeah, so absolutely having the best time getting mentored by you, especially fertility. So we do a lot of focus on those fertility based cases. I'm curious for you, a lot of times mentorships can be really unidirectional.
Mm.
Is there anything that you've been able to gain from it in your own?
Yeah. Yeah. I would say there's two aspects, like certainly you being fresh out of school, there's fresh information or maybe things I didn't have in my education because medicine and especially women's health and especially fertility is evolving all the time. So there might be things that you've learned in school that I'm learning or gathering from you. I think it's also the volume of patients we're able to see now that there are two of us. And so, especially with novel therapies like intralipid treatment, which we're now administering at the clinic, it's happening in your case management with those and the success of that. So I think we're better able to gather more clinical information from that. So that's really helpful for me. and also just working through the process of how I might be thinking about a case to that as well. So I believe it is unidirectional. I think that's just my personality, and our personality is like the curiosity of medicine, and especially with fertility because it's changing all the time.
Thank you so much. Is there anything else you wanted to add?
Has been your favorite thing of clinical practice, or maybe also favorite thing of practicing at Flow?
I can answer both of those.
Yeah.
Favorite thing about clinical practice is supporting patients trying to get pregnant. And then I get the phone call of like, got the positive test. Like, what are the next steps? That's just like the absolute icing on the cake for me. And then favorite part about Flow is just the collaboration. Like even just the mentorship I have with you is fantastic. But there's also so many other female practitioners here at the clinic and naturopathic doctors that have been just so helpful in those quick questions and collaboration and support. And yeah, good.
Yeah. And so, yeah, there's some information, especially with like Naturopathic Medicine Week. And how would you say, in your experience, and I can answer the question too, how naturopathic medicine supports maybe conventional fertility treatment or conventional fertility approaches? Or how does it maybe differ? You can answer it.
Yeah, I would say there's a lot of aspects in terms of how it can support by, there's things that we offer and we have knowledge bases on that maybe reproductive endocrinologists don't use or they're not familiar with. So like nutraceuticals and supplements, any fertility patient going in for, high cost assisted reproductive technologies, they're doing a lot of their own research and it can become super overwhelming. And then the reproductive endocrinologists, they don't, that's not their forte. So to be able to, be that filter of knowledge and kind of like help guide people in terms of how we can support you either during your treatments, before, or if you're looking for an alternative completely, right? Like you're not ready to take that step yet and you want to see what other options there are. Yeah, it's nice just having, the familiarity with the conventional medicine side so that we can also guide patients through that, as well as like where we can safely and effectively implement our treatment strategies.
Yeah. So I think there's like a gap slightly of what we call unexplained infertility, where we don't have the testing available to include or exclude certain diagnoses. So if somebody going through a fertility clinic has done all of the testing and everything is checking as normal, sometimes it's like, what are my next steps? And sometimes it can feel intimidating to jump to IVF, especially when there's no answer. Because the IVF isn't a guarantee. It can increase probability, but it might not be working on the mechanism of that unexplained infertility. And as Dr. Hoskins is saying, we can improve outcomes. So we've seen the differences between one egg retrieval to the next with different novel treatments or support with those individuals and improving those outcomes. I also think that there is a continuity of care, right? So infertility, it's not just potential issues of getting pregnant, it's issues of staying pregnant or recurrent pregnancy loss. So understanding you and your hormonal history, your fertility history, and then how can we support you in that whole perinatal journey? Because oftentimes with the fertility clinic, you're actually discharged once we see you're pregnant, or yay, and then it's kind of like the now what? And it's nice to have that person who knows you and your history throughout that entire process as well. Because Miranda said there's lots of conflicting information online. It's really overwhelming. And especially when you're pregnant, there's so much mixed information that you're given. So it's good to have that full support throughout.
Thank you so much for watching, and a huge thank you to our guest for sharing their story today. If this conversation sparked something in you, don't wait. We're here to help. You can schedule a complimentary 15-minute visit with one of our naturopathic doctors at Flow Functional Healthcare in Edmonton today, or give us a follow, like, or share this video to help us help more people live healthier, more energized lives.